I recently had the privilege of speaking with Dr. Mark McClellan, director of the Duke-Margolis Institute for Health Policy. The Margolis Institute develops evidence-based practical solutions that enhance healthcare accessibility, affordability, and equity. Mark, thanks for joining me today. It's been so exciting watching the evolution of the Health Policy Center to now the newest institute. So as you think of the next 5 years, how do you see the goals and values changing?
Well, first off, Mary, it's great to be with you and the others who are joining us today to be able to talk about the still new Duke-Margolis Institute for Health Policy. As you know, since you helped us get to where we are, we're a university-wide program. Our focus is on improving health equity, and improving the value of healthcare through evidence and practical solutions. And this is an area where there are a lot of challenges today. On the one hand, best of times, best new diagnostic technologies, best new curative therapies, really transformative medicine taking place, great advances in AI and digital health. And yet when you look at healthcare, lots of inequities, lots of problems with access, very high costs, questions about sustainability, and then the health outcomes for our country just aren't where they ought to be. And our goal over the next 5 years, like it has been before, is to make progress on addressing that. The opportunities are there, but just bringing along the technologies isn't enough.
So you've got a lot to do.
A lot to do.
And you can't do it in a vacuum. Institutes by nature, but specifically in health policy, you need both collaborations within Duke and collaborations outside Duke. Speak a little bit about those partnerships.
Well, that's why I'm so excited about the unique nature of the Duke-Margolis Institute here at Duke. We don't have our own faculty, really. We draw on faculty from throughout the university, and the number one source of our faculty is actually the School of Medicine and also School of Nursing and every other school at Duke. And these are experts who know a lot about important areas and issues that matter for improving health and healthcare, but we put that together with some deep knowledge and research team expertise in understanding healthcare institutions, in working with federal agencies, and working with stakeholders, whether it's the investment community or the pharmaceutical biotech industry or healthcare organizations that are trying to do innovative things. And it's putting those two pieces together through deep collaborations on coming up with better solutions.
But ultimately it is about policy and it's about impact. So talk about a few of the more exciting projects that you think ultimately will have that opportunity to change policy and to impact on people's lives.
Well, a couple of areas where we're working very closely with faculty at the School of Medicine and clinicians at Duke Health and throughout the Duke Health system include applying health AI and digital technologies in healthcare, and also on taking steps to address the non-medical factors, the so-called health-related social needs that are so important in contributing to health inequalities and access problems. On the former, as you know, Duke is doing leading work at the cutting edge of health AI, whether it's in predictive modeling or digital twins and making clinical trials, drug development, things like that, or also in just bringing together new kinds of care models that reduce physician time and effort and help clinicians get the information they need, chat bots and whatever's coming next. But our healthcare policies aren't set up for these kinds of technologies. They're set up to pay for services and visits. They're not designed for products that ideally will keep getting better over time, but also present risks of bias when they're applied in other settings from where they were first developed and trained, or problems with effective application in different kinds of healthcare organizations, some with a lot less resources than Duke. So what are the policy approaches that can support that, building off a lot of the work that we do with FDA, with the Medicare and Medicaid programs? They too want to get to the goal of better evidence and better outcomes and lower costs, but our current policies aren't going to work to get there.
It's a big pull. For people that really want to be in this space to come to Duke. So I think we get some of the best talent as well.
I absolutely think we do. And the other additional nice thing about building this kind of collaborative approach here with research, with policy in North Carolina, this is a state where we live in a very partisan and divided time where people are showing that they can come together from both sides of the aisle and solve problems and come up with innovative, effective solutions. And that combination of the Duke research capabilities, the great students that we have, and the networks that we're all building together, that's what gives me hope about the future of healthcare. For all the challenges that we're facing now, all the tremendous opportunities that haven't yet turned into impact on health outcomes and reducing health disparities and making healthcare more affordable, we're making progress, and I think we can do a lot more together.
I love the optimism, and we are so lucky to have you as a leader of the Margolis Health Policy Institute. Thank you, Mark.
It's a privilege to be here. Thank you, Mary.